What I'd like to do now is show you why we get x-rays, show you some wonderful cases with x-rays, and show you what happened to a few patients who just went and got random types of chiropractic, which I don't like. You'll see it quite a bit on the internet nowadays, but stuff that I don't like. So we'll discuss that. And I also want to talk about my team, because I am only here because of my wife, Laura, and Sophie. This is a team all working together. Even our patients, we're a family of patients. You know, there are some times when people might need help, even getting to a table, and we're all here to help each other. So, and I want you to know what this office is all about. The first x-ray I want to show you is a young lady that came in that had, gee whiz, a 21-degree scoliosis. So she has a 21-degree scoliosis. The important things with this, what I want you to see is, number one, we corrected her spine. Back pain gone, feels great, back working out. The second thing I want you to see is she has a 5-degree scoliosis. So she went from 21 degrees to 5 degrees with our type of chiropractic adjustments. That is so wonderful. That's so good. That'll affect her for the rest of her life. And that's what this office is all about. When we talk about spinal correction isn't easy. It takes time, it takes energy. It takes time from the patient coming in and making your visits. It takes energy from the doctor doing the correct and right adjustments when they're needed. Sometimes a patient might have pain on the right side of their body, but they need adjusted on the left. You know what I mean? You have to have a system. The doctor has to know what to do to adjust correctly. So that's an example. Now I want to show you an example of a true case that just happened the other day. This case came in, and this is, there's a few interesting points for this, and I want to get this out here. And again, not for myself, but so you get the right and proper type of chiropractic adjustments. The questions to ask when you call a chiropractor or you're going to come here: do you take x-rays? Do you do examinations? This particular patient was on the back of a motorcycle, and her husband was driving, and they hit a big pothole. She boom, went down, well, not boom, down like that. It was a traumatic injury. Well, a friend of her, and by the way, she has severe neck pain, severe neck pain. And a friend of hers was in a study with her, a Bible study or something. So, oh, I'm a chiropractor, come on over. And gee whiz, she goes over to his office, and he doesn't take any x-rays or anything like that. And he does the old type adjustment, which I don't do. I mean, no disrespect to doctors that do that. You know, you got to do what's right for you, but I don't like it. I don't do it. So she was in such severe pain at that point. Of course, she couldn't go back to her friend, and she felt bad about that because she really liked this doc. And anyway, her friend said, you need to go to see Dr. John. You need to go see Dr. John and Dr. Michelle. They actually do exams and x-rays. So this is interesting. This is why you need a system. She walked in the office holding her head like this. And for you orthopedic people out there, you guys know that's called the rust sign. It's rust sign. That's usually an indicating factor that there's a broken neck. So we do a consultation. She tells me what happened. We do examination. She did not pass her exam. And then we took this x-ray. So let's just look at this for just a second. That injury fractured the upper part of her neck. And I had to send her, and this answers another question, by the way, because of this fracture to the odontoid process, she was immediately sent to the orthopedic doctor, and they had to do some type of neck surgery. So that's the point that I'm trying to get across. Listen, there are so many great doctors out there. There's so many great, all types of doctors. You got to find the one that fits for you and that's best for you.